Welcome back, my friends, to the show that never ends.
Welcome to the show that never ends. Sexual Healing Podcast. Conversations will address concerns and celebrations within the misunderstood and misinformed world of sexual being. Your hosts, Dr. Bill, Mac, and Pipes, bring insight from different sexual health perspectives, covering 70 years of experience.
All right, we're going to jump back into it. Thank you guys for coming back. Thanks for your response from last week's show. I'm Dr. Bill, my co-host Mac and Pipes, and you are listening Sexual Healing Podcast. We had a great response last week when we talked about female sexual dysfunction. We invited all of you who enjoyed the show to add your comments and questions on our email. Our email is sexualhealingpodcast1@gmail.com. We asked you to look at that email, ask your questions, give us comments, and we've got a ton of comments regarding our broadcast and specific questions. So I want to jump into that. And it relates to all things concerning female sexual dysfunction. And as I promised you before, or as promised on the email, we're not going to disclose names, or we're going to be generalized. But I thank you guys for participating and helping us make the show the success that it is. And a lot of it has to do, there were several questions regarding pelvic pain as it relates to sexual health in women. And so I wanted to talk briefly about this, and Pipes and Mac have their input as well, but there are a lot of complaints regarding pelvic pain, and some of the questions related to, gee, how do we know what this is? Is this normal? Is this natural? Is it important for us to just live through it, or should we talk to a doctor about it? Give me your approach towards this, Mac. What are your thoughts on female pelvic pain, and when should someone who's experienced it talk to their doctor?
Well, like anything, when we have any issues with our bodies, we shouldn't just sit back and wait for it to pass. We should definitely go and see somebody, some specialist. I'm not trying to discount frontline physicians. They're awesome. They're great. But there are specialists. Even yourself, Bill, as a urologist, a general urologist, you subspecialize in sexual health. So that being said, pelvic pain is not something to mess with. It could be a condition called PCOS, which is polycystic ovary syndrome, which means maybe too many hormones in your system. It could be a number of things, and it's not to be taken lightly. It's definitely something to be checked out. So if we have a male listening to this, if your wife's complaining of pelvic pain, take it serious. Get her out there. A young lady, same thing. It's not to be messed with. It's very important to overall health.
Mac, what do we do if our neighbor's wife is complaining of that? Should we support getting that addressed as well?
Yeah, because it's just make sure she's on a text thread by just you and her, so
okay.
Not the whole world knows.
All right, fair enough. Well, thanks for that insight. Pipes, give us your 2 cents on this.
Well, I think pelvic pain, pelvic health, all of that, it's obviously going to be different for every woman that's out there, and it may be experiencing it after childbirth, maybe it's during intercourse, maybe it's just like the day-to-day, issues that you're dealing with. It's going to be different for everybody. So yes, I completely concur with Mac that this is one of those things that you really need to address. Go find a specialist. Find somebody who is focused on sexual health. Sometimes even your OBGYNs aren't necessarily focusing on the pain aspect, because I do think a lot of people think that it's kind of normal in certain situations. Again, I'm kind of referring more to the childbirth aspect, that there's going to be some pain. But really asking the right questions, bringing your concerns up, and then finding somebody if your general practitioner or your OBGYN is not as well versed in this or doesn't think it's an issue, but it's a problem for you, then you need to find somebody that can help you with that.
Yeah, I absolutely agree. And by perusing, that's a word I just picked up on, the number of emails regarding that, it is not uncommon. It's very common. And what's important to know is don't be embarrassed. Don't be shy about this, and be specific, because as a practitioner, as a urologist, not a gynecologist, as a urologist, I know the basic stuff. I know that I need to know if it's pain with penetration superficially, or is it pain with deep penetration? Is it with certain partners? Is it in different positions? Is it certain times during your cycle? Is it, be very specific, is it associated with bladder dysfunction, urinary tract infections, urinary incontinence? So as much information as the patient can give to the physician, it's really important to get resolution to this issue. Let's go on to another group of questions. There are a whole bunch of questions regarding pelvic physical therapy. What do you guys know about that? Pipes, let's go back to you.
I can speak as a woman. I was really intrigued by these questions. And maybe this is a little generational, because I was having babies, 20 plus years ago. And I don't think anybody ever talked to me about pelvic therapy, or that it was an option, or that you needed to do it. And maybe it's different, obviously if you're having a C-section versus vaginal deliveries, yeah, things are going to be very different, and your pelvic wall is going to change, and your hips have moved at this point if you're doing vaginal delivery. If you have C-sections, you're not going to have the same issues. You're not going to have to even have, well, women at some point usually have to have a conversation about some pelvic health aspect of things, prolapse, things like that happens as we get older and our tissue gets a little bit weaker, stuff like that. But actually doing like pelvic therapy young, this was total like news to me. Those were very intriguing questions, because that's not something that I've ever addressed, nor have any of my friends really talked about anything like that. So as a physician, what is your take on that?
Well, I can tell you, and I was going to ask you, you're really focusing on delivery, whether it's C-sections or vaginal delivery, but I've got a lot of women who've never been pregnant, never delivered vaginally or with a C-section, that require physical therapy. And I look at it and I liken it to just basic pelvic floor relaxation exercises that you might take in a beginner's yoga class. I play with yoga a little bit as a martial artist, and though I don't, I can't fit into my old tights when I go on vacation with my wife and get into a yoga class, but I will do YouTube yoga tutorials that are basic, that are floor for men and women in the comfort level of my own office or my own home. And it's very relaxing, and it's very therapeutic to learn about the muscles that you can control from a pelvic point of view that cause relaxation. Women, for some reason, are focused on Kegel exercises. That's not a relaxation exercise necessarily. It's used to strengthen particular muscles for a very particular reason. And often people overdo those exercises and they get pelvic spasm. The other thing is, a lot of women, regardless of whether they've had children or not, and regardless of whether they are sexually active, will get anxious, will get uptight, and instead of smoking, biting their lip, biting their fingernails, or pacing, they take their tension emotionally and transform it into an actual physical pelvic tightening, much like people, men and women, who are constipated. That's not necessarily a GI or a stomach issue. It may be an indicator of anxiety. So learning about pelvic floor relaxation, whether with a physical therapist or whether with basic yoga or Pilates or stretching exercises. Very, very, very important, very therapeutic. Do not discount it. Yeah, 10 years ago, I discounted it, and I was wrong. I was wrong. In the last few years, my referrals to pelvic floor therapists has skyrocketed. Mac, give us your input.
Well, I think all of us, Bill's a martial artist, Trish, Pipes is a mom, myself, the health treatment has evolved a lot in the last few years. I mean, we talk about any type of procedure, long scars. Now we have robotics. We talk about physical therapy. We talk about masseuse therapy. We are learning more and more about our bodies as far as how to treat them. You look at athletes. What do they take a cold bath after they work out? They got to cool down. We didn't do that 20, 30 years ago. It's all new. So you've got to embrace medicine as it evolves. And there's a lot of people, as you said, Dr. Bill, you've written a lot of scripts of pelvic therapy, and that's real. And I think a lot of people are doing much more physical therapy now than they ever have. Post-surgery on an ankle, foot, knee, hip, shoulder, it's all correlated. So we got to continue to work our surrounding muscles to support our issue. And being the pelvic, we know that there's issues and muscles there that need to be relaxed and worked on.
So who are you referring your patients to, Dr. Bell?
Well, not all physical therapists know what the hell to do with the pelvic floor spasm
Again, a
issue.
specialty.
Yeah, it's a subspecialty of physical therapists that I can tell you in my area, there are a couple people and there are a couple organizations a couple groups that are specifically trained and comfortable with dealing with this. In the meantime, in the long waiting period, it gets to go from referral to actually when the patient is seen, I turn them on to some of the basic yoga exercises that I use and some of the websites that you could find on the internet. Basic pelvic exercises for the yoga beginner. It's a simple way to start. Now, from a medical point of view, a medical legal point of view, if you guys have pain when you're using this, stop. Don't bear into it. Don't force yourself to work out the pain. Don't walk it off. Stop. There might be something else going on, and wait for that referral to let your doctor know. Let me circle back for 1 second, Mac. You're telling me when you were a professional ball player that the whole idea of ice and heat and massage was not as popular as it is now. Am I that out of touch?
Yeah, oh, absolutely. I think we definitely put our foot in a bucket of ice or put an ice pack on our shoulder or something like that. But, a full ice bath is kind of new. I would say the last 10 or 15 years. I don't want to date myself. Heat packs. I think when we were younger, anytime we got hurt, we always put heat on it right away. Heat. We've learned that ice is the best stimulant of blood. So it's totally evolved. But yeah, it's grown leaps and bounds as far as how to treat yourself post-injury or post-workout.
All right.
It's not the same.
Thank you, guys. Let's jump to vaginal dryness. Vaginal dryness. When is that an issue for sexual health? Does it deter people from having sex? Our viewers have indicated, based on their questions, that's a big deal. Do you guys even see that? Talk to me, Pipes. Vaginal dryness with your girls, with you, with your friends. Well, not with you. I don't want to hear about it. But do you see that as a big issue?
I'm not going to talk to you about my girls' vaginal dryness either.
That's a good point. That's a court-ordered restriction. But what you've heard, let's not mention their names, but is that a big issue socially?
Absolutely. I don't know if it's a conversation that I even necessarily have with my girlfriends or things like that. But yeah, we know that is an issue, and yes, it's going to cause discomfort. And this is where you need to be bringing lubrications into the mix of your partnership in whatever capacity. And I think some people find that uncomfortable. They feel like maybe, or they have a tough time having that conversation with their partner, or they are having vaginal dryness and the partner now thinks that the male doesn't think that the female is attracted to them or interested in having this intercourse. And then because it is painful for the woman, I mean, it can lead to a lot of emotional and physical issues amongst a couple.
And from a medical point of view, it is fixable. You don't have to be on hormones. There are a lot of over-the-counter skin lotions, if you will, that make a huge difference. In fact, that's someone's alarm reminding them to use the vaginal skin lotion for their dryness. I want to talk about two questions that are very important, and we're going to pick up on it again because we want to keep up. We want to be sensitive to the time issue. Birth control pills, guys. I'm going to take over. I said, talk to your doctor. Birth control pills are very important, but birth control management is unique to every individual, and everyone doesn't have a great time, a great physical response for birth control. It may decrease their libido, cause pain, cause dryness, and something. Please, guys, talk to your healthcare professional. It may not be your primary care doctor. It may not be your urologist. It should be your OB, and it certainly should be your gynecologist. Look at that. And the last global question, 20 seconds each. Tell me, how do I know if I have a problem in my relationship? Is it my problem? Is it my partner's problem? Is it both? Mac, get me your read on this before we leave.
I don't think anybody can look at themselves and being in a relationship and saying it's me. Everything is shared, whether it's one person that's discomfort or one person that's enjoying. They both have to come together and have the same experience. So don't look at yourself as I'm the problem or I'm the reason. Sexual health is a couple's problem for the most part.
Great message. I thank you guys for listening. I thank you guys for adding to this segment, putting your questions down on our email. Remember, you're part of this. We're here to educate. We're here to entertain. Sexual Healing Podcast.
One thing, Bill, let me interrupt real quick. We're addressing a lot of sexual health. I don't think people understand that your insurance most likely will cover treatment for this. And a lot of people don't go forward with sexual health issues because they're afraid it's going to be a lot of out-of-pocket expense. So please, don't let that deter you. Check with your insurance carrier, check with your doctor, make sure it covers. Don't let that deter you. Go seek help.
Keep those questions coming. Sexual Healing Podcast 1 at gmail.com. Thank you guys for listening. We'll see you next week. Thank you, Mac. Thank you, Pipes. Dr. Bill signing out.
Thank you all.
Welcome back, my friends, to the show that never ends.
Thank you for joining the show that never ends. We will pause with our part. However, you can reach us at sexualhealingpodcast.org. We are here to make your sexual health be everything you want it to be. We'll visit with you next week for another episode of Sexual Healing Podcast. Stay sexy out there.